Welcome back to Open Your Eyes, and now we are venturing off into our second segment for the morning, the Ministry of Health and World Pharmacist Day. That's what we're about to discuss. So 25th September, which is today, safe and effective medicine for all. That's a theme that they're venturing off into as well for today. Now, to tell us more, we've got Samira Williams-Gongora, who's a pharmacist and at the Pharmacy Unit, Ministry of Health, and also Chrystal,
Samouge.
Thank you so very much, Chrystal Samouge, pharmacist and at the Pharmacy Unit, Ministry of Health. It's so nice to have you in. Good morning.
Good morning.
You know, firstly, I want to apologize. I when I saw that name, I was like, oh man, I don't know if I said this one. But it's nice to have you guys, and you're looking wonderful.
Yeah.
Today is that day we're actually celebrating, and I'm glad that we could celebrate with you. So tell us about it. How are we going
Pharmacist Day
Happy
to you
Pharmacist
guys.
Day.
Thank you.
Yeah. So what are we doing to celebrate?
Well, this year under the theme, Safe and Effective Medicines for All, we're teaming up with the nutrition unit, and we're doing a soca walk this evening.
Nice.
And also we are appreciating our staff or pharmacists that work so hard out there every day.
Yeah.
And we're doing a professional skills development training tomorrow. That's tomorrow and Friday. So we are showing our people appreciation for the hard work that they do every day.
How many registered pharmacists we've got in the country?
It's about 100 and maybe about 120 around there.
There have been some recent efforts to enhance the enforcement of the work of pharmacists and the licensing as well. Talk to me about this particular initiative and how we're doing at this time.
Okay, well, in addition to the theme for this year, the World Pharmacist Federation chose this theme because they want to look at pharmacists as guardians, as promoting safe medication, and in addition, reducing medication errors. And I feel like this particular theme speaks to us in Belize because we're in our infancy stages of having the regulations, ensuring that safe and effective medications are being imported into the country. And also, we're starting our pharmacovigilance where we're ensuring that patients get safe medication and it's being used for exactly the condition that they're treating, and without adverse drug reactions.
Just to add a little bit on that, when we think about the theme, Safe and Effective Medicines for All, we can think about it as having two parts. So we have one, the pharmaceutical product, and you know the Ministry of Health has been moving forward with ensuring that we have safe medications for the population. So that's one, the pharmaceutical product. But we also have the services that pharmacists offer, because pharmacists play a very important and unique role. So as Ms. Gongora was saying, we look for things like medication errors. We make interventions for patients because something could be safe and effective for me, but it might not be safe and effective for you. So that's where a pharmacist comes in. They work along with other healthcare professionals, provide information, and ensure that the patient is getting the most appropriate care, and the patient is able to achieve their healthy outcomes.
I think I'd like that you segue there, because that's one of the things that I feel the public is not sensitized about. Like because you go to the counter, you tell the pharmacist, hey, I could have an Advil please, and then they just give you the Advil. There is not that conversation between the customer and the pharmacist in terms of, okay, this is how you use it. Are we able to ask that question when we get to that spot?
Most definitely. I think for many years, pharmacists have been looked at as dispensers and someone counting tablets and putting it in a bag and labeling it. It's much more than that. Okay, the profession is changing and the roles are changing. We're now becoming important team members. We're working along with physicians, nurses, and we're just you know, we're working along with the team to
Yeah.
ensure
Yeah.
that patients get appropriate care and the best care that's possible. You can definitely speak to your pharmacist. If your pharmacist isn't visible at the time, you could ask for a
I was going to
pharmacist.
say, first
That's
of all,
the thing.
make sure it's the
The
pharmacist.
pharmacist
yes.
you're speaking to, that's what I wanted to add, because sometimes you see that the person there that attends to you, but you need to ask for the pharmacist.
Yeah.
That's the one that's knowledgeable. Because to you it's looking, oh, we're looking at the prescription, they're getting medication. All the activities happen in the pharmacist's brain. They're the ones that analyze these, make sure that there's not an interaction between medication that you're taking. Interview, are you pregnant? Are you, you know, these are things that can affect the outcome of the patient.
Yeah.
Or
yeah.
whether
know?
you can have dairy or be in the
Right,
sun, or when you
exactly.
or when you have to take
Right.
it with food. Because a lot of times people say, "Oh, this medication makes me sick." Yes, are
Because-
you supposed to
right.
take it with food or not?
Right,
Yeah.
that's the thing. So, and that's where our pharmacovigilance comes in as well, because we need to sensitize our patient that it's okay to come back.
Yeah.
It's
Yes.
okay to come back if you're having an unwanted effect, something that you weren't warned about.
Yeah.
Because with we don't manufacture anything here.
Yeah.
We import 100%. So our post-market surveillance are a little bit behind.
Yeah.
But we are getting the medication that are being manufactured worldwide, and so we are seeing these adverse drug reactions, and it's going unreported.
Yeah.
So that's why we're in our infancy stages of getting our pharmacovigilance up and running and using the forms from CRS, the Caribbean Regulatory Authority, and being on board with that reporting mechanism.
So a couple of years ago, there were pharmacies popping up all over the country. I mean, it was more common than your grocery store, it felt like. And it was concerning because a lot of these pharmacies they didn't have a pharmacist in there. I know there were subsequent moves to ensure that you would inspect and make sure that the pharmacists have a licensed pharmacist, that their registration and their license is visible, and all these other inspections. How are we doing now in terms of enforcement, ensuring that people are legitimately running a pharmacy, not just to turn over profit, but because they will help whoever comes in and needs medication?
Well, we've made great milestones in terms of that, because we have closed down some pharmacies.
Yes.
We've moved
I've
to close
noted.
down some pharmacies, and also we've warned some, because we find that some establishments have the name of the pharmacist, but they're not present.
Yeah.
So we warn them and we tell them, this is the law, this is what you need to do. We're not hard and fast. We'll give you a time to fix it,
Yeah.
and then we move in.
And even proper storage.
Right.
Yes.
That is one of the main part, because there's a checklist, because the Ministry of Health is the regulatory authority, and that makes up of several departments: the LNA, which does the licensing, the inspectorate unit that inspects, and the pharmacy department that does the importation.
Yeah.
And so us together, we check for everything when we're doing the inspection, from opening to routine inspections thereafter, and also yearly licensing.
What about proper labeling? Sometimes you get medications, they don't have, I mean, it depends. If it's a prescription, then you will have your written labels. But if they're other over-the-counter stuff, sometimes you can't even read the language.
Well,
Okay.
go ahead.
Yeah.
Okay, we've actually been moving towards correcting that as well, and we've made some great progress with that. We know that now the labels should be in English, Spanish, or both. In last year, we had an issue with some labels that were in foreign language, and they weren't allowed to be in the country, because in actuality, as a consumer or as a patient, if you cannot read, for example, the leaflet or the pamphlet, and you don't know what you're taking, I mean, what benefit is that to you?
Yeah.
Being a patient is also about making decisions on your own, and pharmacists work along with patients to make decisions. So if they see something on a leaflet, for example, and they have a concern, they should be able to speak to their pharmacist about it, and they can work it out.
Yeah.
But if something is in a foreign language, how is that going to happen?
Absolutely. Ladies, it's the day is meant to commemorate those who choose this as a profession. Let's not lose the opportunity to find out why you both did. What about being a pharmacist appealed to you?
At the age of, I'd say 13, I found medication to be awesome. it was magic. If I had a headache and I popped two, that time it was anacin.
Yeah, anacin, yeah.
You know what I mean? And I popped two anacin, and within like half an hour,
Good.
I'm good. And I said, you know, like, what makes this work?
Yeah, like magic.
Yeah, and so from that age, I was very fascinated about medication and the way it works.
Yeah.
And the fact that sometimes you see people on the hospital and they're not doing so well, and being in there a couple of days, and then you see them bounce right back.
Yeah.
And so that's always had fascinated me.
And for you, Chrystal?
I would say the same. I like science. So it was very interesting to see medication working. My mother is actually a nurse.
Wow.
So I was, very close to that. And it was just interesting to see people getting better, as Samira said, and you're wondering, how does that work?
Yeah.
And when you realize how important the pharmacist's role is in it, in your education process?
Oh, even better.
Yeah.
I mean, having that rapport, having people coming back to you to say, you know what, remember that word? And it was wonders. And that's
feeling.
That's priceless.
Yeah.
That's the
That
greatest
gratitude
feeling.
is priceless.
But
Not everyone is open to ask their pharmacist questions.
No, because sometimes when people are not so well, we know that they already waited to see the doctor and they're already not feeling so well and groggy. And when it comes to us to get the medic, just give me a make a go. You know what I mean? And so, but we're the last contact with you.
Yeah.
You know, and we kind of review all our healthcare professionals' procedures, and we look at the notes and we make sure that there's no mistake, and what you're getting is actually to treat the condition that you have. So we definitely need to have that interaction with you, and take the time to listen to your pharmacist, and also your pharmacist will listen to you in terms of things that maybe you might be taking that's not prescription that will affect your prescription medication.
You know, one of the things that stuck out to me, there are a lot of people who feel exactly like you guys did in terms of wanting to become a pharmacist. But at the same time now, you've got your parents behind your mind telling you need to elevate your skills, elevate your skills. Now, being a pharmacist, am I able to elevate my skills from just being a pharmacist to something else? How far can we go as a pharmacist?
Well, we want to first of all big up UB.
I was gonna say.
Right, we want to first of all big up UB from taking the entry level from the associates to the bachelors. That started in 2017, so we have people in there. And we also are on the second cohort. So kudos to Mrs. Thurton and Mr. Abubakar for taking it to that level.
Yeah.
And then in addition to that, there's branches of pharmacy that you can lead out to, which is procurement, the distribution.
Yeah.
There's also in the hospital, the clinical portion. There's the public health, the primary health portion.
Yeah.
And so there's other branches that you can branch out to in terms of pharmacy.
Yeah. And so I know a lot of even career pharmacists have gone back to UB to get their bachelor's because because it wasn't offered before. You did have the associate's level, so but now you can be able to access higher education. How much is the profession growing? How much are you finding new interest?
Oh, well, this year, actually, for the first time in recent years, we've had 25 applicants to sit the board exams. And so we're hopeful for that crowd so that it can fill the gaps and the vacancies in pharmacies that don't have a pharmacist.
Yeah.
So we're hopeful, and there's more coming out.
Yeah.
And so
why do you think this sudden interest?
well, because I think maybe because the industry is being regulated and we're being more out there, which is an opportune time for them to be involved because it's structured. You know, and so there are people that realize what we're trying to do, and they're getting there.
Now, you don't always deal with people who are just ill and want to feel better. Sometimes you deal with people who are not so nice. In a system where people were able to access anything, even things that they weren't supposed to get before, and it could be prescription drugs that they got without prescription. It could be, and we know this one because we bring it up all the time, the access to antibiotics as freely and loosely as it has been before. And so they come into a pharmacy and they want X, Y, and Z. How do you help people to recognize why there is the need for enforcement now?
Okay, I believe it starts with education.
Yeah.
People need to understand why it's harmful for them to take something, for example, an antibiotic, when it's not necessary.
Yeah.
They may not know everything that follows that, right? So I think education is the first step, and pharmacists play a big part in educating patients.
Yeah.
As it relates to that as well, with the inspections, as we mentioned before, a part of the inspection is also checking the registers. So pharmacists should have an antibiotic register. They should basically keep a record of all the antibiotics that have been dispensed, all the prescription medication that have been dispensed, dangerous drugs, everything. And in some cases, they may go as far as matching the number of prescriptions or matching the number of medications that have been dispensed to the number of medications that were purchased by the pharmacy to ensure that everything matches. So we're trying our best to cut down these occurrences.
But in terms of the patient though, because you get the troublesome patient, it's a matter of, because with antibiotics, AMR is real. Right, which is antimicrobial resistance.
Yeah,
and
which means the antibiotics don't work on you.
Right, and we don't want 15 years from now you're having an infection and you're taking the antibiotics and it's not working, and because it comes at a high cost to the world actually. And then you'll have people dying. And we don't want that. And in terms of control drug, there's a law. So you can't sell it without a prescription. And we're seeing in the US that there's this this fentanyl epidemic, and we don't want that here. You know, so those are the things that you need to advise the patient.
Wow.
What about, because a lot of people are into their supplements. And so they're taking supplements and they don't think of telling the pharmacist, well, I'm taking X, Y, and well, usually they take like 10, but it's like a stack of 10. Is it important to tell your pharmacist what type of supplements you're taking as well?
Yes, definitely. There is. Because there could be interactions.
Yeah, there could be. So would it be, if I'm going to buy a medication, wouldn't it be then best for the pharmacist to ask me the questions?
If you have any health conditions, if you're on any medication, if you're pregnant, anything like that. Those are the conversations that should happen between the patient and the pharmacist.
Right. So with increasing the level of education with the pharmacists, we're looking at the entire pharmaceutical care of the patient. So it's not only giving the medication, but finding out, are you well? Are you on other things? Do you need to lose weight? Do you need, you know what I mean? So it's looking holistically at the patient, and that's where we want to be.
Nice. How has the profession changed just over the time that you've been a pharmacist?
Oh, wow. We are having, I remember coming into the profession, sometimes you used to see the private sector pharmacists behind the wall. I mean, they only come out when it's time to dispense. They were behind the wall pretty much in the dispensing area. But now we're having pharmacists coming out, meeting the community and so forth. And so, because for instance in Belmopan, where there's a private sector pharmacy, MediPlus, that's having a health fair today.
Oh, nice.
Yeah, they're having a health fair today, and tomorrow they're going to be having a weight loss challenge. So you can sign up, right? Better body, better mind.
Nice.
And they're going to be having a blood drive. So you're seeing pharmacists coming out into the community, educating the community that they're surrounded by, because pretty much anything that happens to that community affects them.
Yeah.
That's nice.
Yeah, that's key. And so we spoke of very early on some of the activities that you have. You have your walk and Soca walk.
Yes.
But you also said there's some training that's taking place.
Yes. Tomorrow and Friday.
What areas are you being trained in?
It's pretty much personality, well, not personality, but professional skills development, teaching our pharmacists to be patient, time management, and so forth, personal develop, because we're humans too.
Of course.
And we feel the need to advise our patients that, or staff that we feel you, we know that you work hard, and so in keeping with everything that's happened and the challenge in their personal life, how pretty much to deal with everything.
And all those different personalities, right? When they come in and want their
or
their flu packs or whatever other concoction.
Flu pack.
Is there any regulation on medications that make false promotions? Like, you know, sometimes you find, or I hear ads on the radio saying that something is going to solve or cure cancer or diabetes.
We do.
We actually
And
have a
we
case
have,
right now.
yes, we do.
We have a case right now.
But what's lacking on our part is pretty much the legislation. False advertisement, we need the legislation to come so that we could put those that are false advertising, we could charge them, and that it is illegal. Because they're coming into the country, they're probably being cleared as supplements, which means it doesn't come through us. And then they're claiming a lot of things. They're claiming that they're
it's like a miracle
to treat
drug.
everything. And so we can't be unleashing that to our people, especially the sick people, because it's people with cancer, terminal illness, and so that they're targeting. And it's unfair because
and when
they
you
give
are
them hope.
desperate to feel better, you'll try
anything.
Yeah.
And it's unfair because it's false hope that you're giving
So
them.
we're working on correcting that one?
The legislation, yes.
Okay.
Yes, we are. We're inspecting those facilities. We're advising them. But to have more teeth, we're working on the legislation.
All right. Well, let's remind everyone what's happening today on World Pharmacist Day. Your walk takes place in Belmopan.
Yes.
What time does it start?
It's 4:30 this evening, just about when the sun is going down. So.
Is it pharmacists only or open to the public?
No, it's everybody. It's all government departments. It's the Ministry of Health on a whole. Yes.
Soca walk.
Yes.
Wow.
So it's a dance and walk. That's what it is.
That's right, because it's in line with Wellness Week. So.
All right. Safe and effective
any
medicine
message to pharmacists who are watching as we close?
Oh, we want to wish all our colleagues a happy Pharmacist Day today and week. And also, the association is having their AGM on Saturday as well, and a social afterwards. So we want to wish everybody that a happy Pharmacist Week, like I said, and that we appreciate you. Keep on doing the good job that you do.
All right.
And we appreciate the work that you do as well. Thank you very much for coming in and enjoy your celebrations. What we are going to do now is take a break, and when we come back, we'll be talking to representatives of BTB about Beltravex. So please, stay tuned.